President.
All right. Good morning, everybody. Good morning. Good morning. Good morning. The chair detects a quorum. Welcome to the Regional Council Body of the Greater Nashville Regional Council. It is Wednesday, June the 17th, year 2026. I want to thank everybody for being here today and welcome to those who are joining online. You have the minutes before you, so I'll entertain a motion in a second when you're ready. Thank you for the motion and the proper second. Any discussion, corrections, or additions to the minutes? Seeing none, are you ready to vote? All in favor, please say aye. Aye. Any opposed, say no, and those minutes are adopted. Next item on our agenda is opportunity for public comment. Any member of the public here that wishes to address the Regional Council Body? All right, we have two action items before us today. Item A is Resolution GNRC 2701, adopting the annual work program and budget for the next fiscal year. So I'm going to call on Mr. Skipper to present that to us, and then we'll go from there.
Thank you, Mr. Chair. Good morning, everyone. Good to see you all this day in June. Staff is ready to present the work program and budget for fiscal year 2027. This has been developed over the last several months with significant input from the board of directors to this council body, as well as our staff leadership internally. So I'm pleased to present to you the proposed work program that would become effective July 1st and run through June 30th of 2027. The document is in your packet and available online at gnrc.org/annual budget. This is a really useful document. It describes to you and our partners at the state and federal level and the general public the role, responsibilities of GNRC, our federal designations that help keep all of you eligible for federal grants for a variety of infrastructure and social services projects. And then it goes into pretty good detail about the program of work, the individual tasks and proposed activities that we intend to undertake in 2027 with the available revenue. And I'll talk a little bit about our budget here in a minute. The document also includes the budget in the back, along with an organizational chart and information about our regional council body. Again, gnrc.org/annual budget to access the document if you don't have the packet in front of you. I should also mention, if you have your tablet or computer in front of you and want to follow along with these slides are available at gnrc.org/slides/council. Just so you know. Slash, a couple more slashes. Okay, so this matrix is, we show this pretty often, but it updates pretty regularly as our mission doesn't change, but our scope of work does change based on how you engage us through voluntary agreements, but also as our work is defined by federal and state grants. This is a matrix sharing with you a simplified overview of the types of activities that we plan to carry out in 2027. It's typically segmented in three verticals. We have social service activities, we have planning services that we're providing, and then we have economic and community development services. And some of the work that we do cross over these verticals so that we make sure that everything that we do is fairly integrated and comprehensive in our approach. And then the work that we do through those verticals are supported by activities carried out by our external affairs and community engagement team and our research and analytics team. This is a graphic sharing with you our typical budget flows this is a 2025 budget for illustrative purposes. 2025 budget was a $25 million annual budget, with 64% of those funds in that year, and really any typical year for GNRC, are sourced from federal grants. The majority of those federal grants funds flow through state agencies. And then we do have some direct grants with federal agencies, but about 2/3 of our funding is coming from federal sources. 25% of our money is coming from state sources. That includes state grant programs, so state revenue through grant programs through the state agencies. And then there is a little bit of money. It's really important and critical funding, but a little bit of money that is included in the governor's budget approved by the General Assembly as directed by TCA. The code requires that the state allocate certain amount of money each year to the development districts across Tennessee. We work together with our counterparts across the state to modernize that code last session. I'll talk a little bit about its budget impact here in a minute. And then 11% of our funds are sourced locally. That includes the dues on a per capita basis that you pay, which provides matching dollars to those state and federal grants. But it also includes the revenue that we generate through contracts with all of you who have engaged us for local planning services or grant writing, grant administration services, so on and so forth. So that's a general look at where our revenue is coming from. And then in terms of where it goes, more than half of our budget in 2025, and really in any typical year, we pass through our agency and in the form of direct services to Middle Tennesseans, particularly older adults or those with disabilities. We're using our budget to directly improve their quality of life, or we're subgranting that money to local communities or nonprofits. When I say subgrant, I'm not talking about the MPO transportation improvement grants. That 1.5 to $2 billion work program for the MPO is not incorporated into our budget, but our budget allows us to do the work to make sure that the MPO tip is out there for you all to access. The remainder of the funds are what we use to operate ourselves. About 11% of our total budget is for administrative costs, a pretty low overhead rate for our agency. The bulk of the costs for salaries are for program staff that are doing the planning work, the economic and community development assistants, for social workers who are out there helping Middle Tennesseans on a regular basis. Of course, and the program expenses includes office and technology and other direct costs that support the work that we're doing for the region. Any questions about the typical flow for our annual budget? Seeing none, I will move on to the next slide. So this is a little bit, this information is typically published in our annual report, gives you a sense of the source of funding by the major verticals of the organization. I think what's important to focus on here with this slide is the diversity of the state and federal grantors that have engaged GNRC to carry out work on their behalf. That's really what we're trying to illustrate here. We do work with about every single state agency contractually, and then we have a growing list of federal agencies that we're doing work with. Most recently, we added the Department of Defense. They have awarded money to us to carry out a joint land use planning study with Clarksville for Fort Campbell in conjunction with Clarksville, Montgomery County, and a couple of counties in Kentucky, just to make sure that the base's long-term mission can be sustained given the rapid growth and development around the installation. As an example of some new engagement that we have with the federal government, a couple of years ago, we received $1 million from the US EPA, for example, to help our region begin to reduce emissions across our area. And so that was a direct engagement with EPA, for example. But you see there the list of state and federal grantors that we're engaged with on a typical basis. For 2027, and again, this budget is included in the full packet at the back of the annual work program and budget document. A few highlights here. Currently, GNRC members pay 44 cents per capita. That's based on, for 2027, that will be based on the 2024 census estimates for your community. There's always a lag in those estimates being published through the state data center. We have proposed an increase in that rate to 45 cents per capita, so a 1 penny increase in the per capita rate. Your actual amount due was published back in February, and we've shared that a couple of different times over the last few months. It's the full due schedule is also on the website at gnrc.org/budget, where you can access all of our budget documents. But that's included in the budgets that proposed 1 cent per capita increase, and we also have we're showing about an $80,000 increase in the amount of funds that we get through the state. And pursuant to the code that I mentioned earlier. The development districts work together in committee leadership at the General Assembly and side by side with the administration to modernize the formula that was in the code to fund development districts. That hadn't been changed really since 2007. And so essentially now what we have in the code is that the state will budget 50 cents per capita statewide for development districts. And then that money is distributed to development districts through a formula that we develop in partnership with each other and the Tennessee Department of Community Development. Our share as a region of that total doesn't quite equate to 50 cents per capita, but in terms of the state's contribution to development districts, we've got this built-in mechanism that as the population across the state grows, their investment in development districts will also grow with it. Is the idea in the modernization of that code. Another highlight from our budget is that we have going into 2026, we will have finally phased out the remaining American Rescue Plan Act funds that are supporting some of our social services work on the aging disability side. We have also being able to propose an increase in the allocation to our budget for our long-term cash reserves and capital fund, which has really been an important topic of conversation amongst our board of directors, who just want to make sure that we've got sufficient cash on hand to be able to get us through those rainy days, and to also prepare for our long-term investment in our facilities as an organization. The budget includes pay increases for staff hired before July 1st, and other adjustments for promotions, reclassifications of pay equity. Sort of the minimum across the board pay increase is about 3%. Not quite keeping up with inflation, but we wish we could do more, but need to be sustainable with our budget, but have included that in what is proposed to you this morning. And then of the total budget, about 43% of that is being passed through to local communities or provided in the form of direct services to Middle Tennesseans across the region. I think the most important thing for you to realize about our budget and the dues that you pay to GNRC is that it's making us whole for the year as an organization that you all are owners of. But more importantly, the work that GNRC does is what qualifies you and keeps you eligible for the billions in state and federal grants that are out there to support infrastructure and social services. And so I know from time to time, some of you have pretty healthy conversations with your local legislative bodies about the dues that you pay GNRC. We're not an industry association. We're not a nonprofit that is just hoping to get contributions. Much respect for those organizations, but the dues that you pay to us have significant ROI to you and keep you eligible for the big dollars that are improving your communities on a day-to-day basis. So that's something I will end with in terms of the highlights. For those interested in the numbers, the details are in the back of the work program, but in general, we're looking at a $27.8 million of projected revenue for 2027. We've programmed 27.2 million of that. We don't budget to zero because some of our revenues are based on estimates with money that hasn't yet fully been appropriated by the federal government or issued to us in contracts. Contracts happen for us throughout the year, so we want to be a little bit conservative. If we budget to zero, we're probably immediately going to be over budget some of these items, but it's not a surplus in the end. Anything that we don't draw down will carry over typically to the next year for programs and services. So that's a look at the revenue and expenditures. And again, 43% of this budget is in the form of subgrants and pass-through, and our administrative overhead is about 11% of the total budget. And then you see there the set-asides that we do from your dues for government affairs, the capital fund, and cash reserves, all amount to about 0.5 percentage point each of our total budget. Any questions about any of the information that I presented so far? Well, with that, Mr. Chair, we'll toss it back to you with a request for the council to entertain adoption of resolution GNRC-27-01.
All right, thank you, Mr. Skipper. You've heard the highlights. I'll entertain a motion in a second for the purpose of the discussion. Thank you. Properly seconded. Any questions, comments regarding the work program and the budget? All right. All in favor of adopting the annual work program and the budget, please say aye. Aye. Any opposed? Thank you. That is adopted. I want to say thank you to Michael, you and the staff, Megan, Michelle, everybody for pitching in and doing a great job. So thank you for that. All right. Next item for action is election of officers. The moment you've been waiting for. Say thank you for the opportunity to serve as your chair for the past 2 years. And we look forward to supporting the next slate of officers that are going to be elected. So Michael, if you don't mind.
Thank you, Mr. Chair. I'm going to get this item essentially on the floor, but with some background information, but then toss it over to Mayor Bogle, who serves on our board of directors, who will present a slate of candidates on behalf of the board of directors, which meets quarterly to work with me on the execution of the work program that you just adopted. For background, we've included the bylaws, the full set of bylaws for this body in the packet for those of you who haven't reviewed those in a while, but the bylaws essentially implement the requirements of our statute with respect to the board of directors, the regional council body, but also the officers. And so the statute and the bylaws that are in your packet call for this body to elect a chair, a vice chair, and a treasurer that names whoever the individual is as executive director as an ex officio member of the board in the form of the secretary. The current officers are completing their second one-year term. It's the bylaws call for one-year terms, annual elections. It's customary, informal tradition for the officers to be reelected to a second one-year term. It's a little bit of drinking from the fire hose as you get into the leadership pipeline for the organization. So it's really that second year of your service in the position where you can be the most effective. So that's the tradition there. And so each of these officers are finishing their second one-year term and are expecting to either kind of move up in the leadership pipeline or roll off. But immediate past year, I'd argue, is one of the most significant the roles for the organization. So you see there the current officers. Mayor Pitts to my left has been serving as chair for the last couple of years. Mayor McCarver as our vice chair, and Countess Mortimer, Mary Esther Reed as our treasurer. I'd love to hand it over to Mayor Vogel to present the slate of candidates for the 2027 program year on behalf of the board of directors.
Thank you, Michael, the chair, board. After careful consideration and long study, nominations offered by the board of directors for 2027 year are chair, Mary Esther Reed, Smyrna, vice chair, Mike Pottergroup from Humphreys County, and treasurer be Jack McCall, Trousdale County.
All right, you've heard the nomination for this slate of candidates. Do I hear a second?
Right.
Thank you for that. Any discussion? Anybody wish to nominate anybody from the floor?
I note that Mayor Reed is not present today. So
Get elected.
Okay. Are you?
We should let the mayor call Mayor Reed and inform him.
Can we just get her online somewhere?
I got that.
Okay. Thank you. Thank you. All right. Any other comments or smart remarks we want to make? All right. Well, if you're ready to vote, I'll ask you to all in favor, please say aye.
Aye.
Any opposed? Congratulations, and I look forward to working with the officers that are coming in. Thank you for your willingness to serve. All right. I think we're now ready for appointment informational items.
Yes, sir. I'll be very brief. You probably had enough of me already today. So this is more of a heads up that particularly if you're a county mayor, county executive, that will be following up with you. You have a very important role to make appointments to this body as well as other boards and committees that serve the organization. For county mayors / executives, each of you is asked to appoint a business rep from your county to this council body. They are voting members of the regional council body. So we have 13 business reps. Nathan is the business rep from Williamson County, for example, appointed by Mayor Anderson. Each of the county mayors, executives are also asked to appoint somebody from their community to represent issues of social equity and inclusion. And then beyond that, county mayors and even to some extent city mayors as well have a role in appointing members to our advisory committees, namely the Transportation Coordinating Committee, which advises the Transportation Policy Board for the Nashville Area Metropolitan Planning Organization, and the Aging Advisory Committee, which advises this body, the Regional Council, in your work to steward and direct the Older American Act funds from the feds and the state funds investing in older adults across our region and those with disabilities for our programming as the area agency on aging and disability. So we'll be following up to refresh your appointments. If you like who you have in that spot now, no need to swap them out, but there are some vacancies, so we'd like to get those filled so we have full participation across the region. And for all of you around the table, this is just an annual reminder that if you haven't designated a voting alternate to this body or any of the other boards that you serve on, now's a good time to be doing that. And you can designate a designated alternate to vote on your behalf in perpetuity, or you can designate them for individual meetings. But we do take action at these meetings from time to time that are necessary to ensure the continued flow of funding to local communities. So quorum is really important. So it's better to get ahead of the game there when it comes to setting your designated alternates. And then also we asked the mayors within each of our counties, and I'm talking about municipal mayors and county mayors, county executives, to work together around this time of year to think through who your representative for the county as a whole will be to our board of directors. For the communities that are represented by the folks that were just elected officers, they will be the representative to the board for those counties. So Mary will be the representative for Rutherford County, for example. But for those counties not represented by an officer, we'll ask those mayors as a group to get together to determine their representative to the board of directors. And that's a process. Typically, we ask the county mayor to lead, but staff is willing to help facilitate that in any manner that makes sense to you all. Right? So that's just a heads up that that process is coming. And then finally, I'll work with the chair to engage our legislative delegation to make sure that we have the appointments from the General Assembly who sit on this council as well. We have a vacant representation from the state Senate. Susan Glenn is the designated representative for the state House, to this. So again, just a heads up, and Mr. Chair, appreciate the opportunity to do that this morning.
Okay, questions about committee and board appointments? Comments? All right. We are now ready for the next informational item. Pleased to welcome Austin Waters from the Tennessee Department of Health to give us a briefing on the Rural Health Transformation Program. Mr. Waters, you're recognized.
Thank you. Really honored to be here. Thank you, Michael, for putting this together. I think I've spoken with a lot of you already about the Rural Health Transformation Program, and I've been in every one of your regions and districts talking to folks about this program. Let's see if I can make this clicker work. There we go. So this is part of a Congress passed $50 billion to go into rural health transformation for healthcare. Recently, Tennessee, through its application, was awarded roughly $207 million in the first year, and over $1 billion estimated for the next 5 years. This will serve as probably one of the largest, if not the largest, investments into rural healthcare in our state's history, certainly, and most likely in our nation's history. So a few things, I'll skip past this. This is maybe one of the more important slides. This is going so fast. This is going extremely fast. I would recommend and I would commend the business development districts for their help in the grant writing process, because all funds have to be obligated by October 30th. Obligated. That means the grants are already opening and closing right now. They are 30-day openings on those grant windows. I've been joking with my staff that I had hair when this started. So this is moving very quickly, but we have been doing everything we can to get in rooms like this, to get in front of people like you who care about your community, who know your community's need and can really act as the catalyst to bring people to the table, and ultimately through our pipeline to draw these funds down for rural health dollars. Here is a draft of this. I would use the laser, but there's some folks out there and I'm kind of a long distance. So I don't want to blind anybody. If you look at the screen, you can see that one of these is already closed already. There are other opportunities opening up that are open right now, and there are some that are coming to be open. I'll see if we can get to that list on this next slide. There we go. So these are the big buckets that we've kind of broken things down into. Tennessee has focused on 5 major areas. They break down into, in total, 47 different areas. The first question I usually get is, so what can we use this money for? It's actually easier to say what we can't use this money for, because it is such a wide swath. As many of you know, when you paint with large policy brush strokes, it doesn't get down into the nooks and crannies. This tries to paint the whole thing in one big brush stroke. So there are 2 opportunities I'll mention in particular. One, this opportunity, RHTP, is not really used or intended for capital. So if you want to say you want to build something new, you want to open up new rooms, that's not what this is intended for. Because of that, the Tennessee State Legislature came in behind us and put $100 million in the RAMP program that can be used for the brick and mortar. So essentially, if you have an idea for rural healthcare or for serving rural health residents, we've got money for it, and it's going fast. Sale now, buy, Sunday only, whatever you want. Please come to our website. So I'm going to push through a few more of these slides. So this is what we've talked about, some of these RFP opportunities that are coming after the RFA opportunities that I just showed, e-consult platforms, cessation, mobile app for pregnancy and postpartum. There's a couple things here. I'm going to tell you where to go for a lot of these resources. So I find it very helpful to look at the examples because, again, this is such a large behemoth of a program. I find the examples to be most helpful. And then I'll try to go through this as time for questions at the end because a lot of people, I love to play the can we use this money for game. It's a great game. It's very fun. So expanding or modernizing clinical services or facilities, that's service expansion and co-location. So maybe you already have, I think of it like square footage. So if you're not looking to expand the square footage, but you're looking to change square footage into a different type of service at a healthcare facility, you're good. If you're looking to go into a space to co-locate, that's a great use there as well. We've been talking with a lot of other states to see what they're doing. I've really enjoyed seeing these models where they press into where the people are or where the students are going to schools, co-locating there, things like that. Improving maternal, infant, or child health outcomes. That would be the maternal and child health grant. Anything that falls into that category, whether that be remote monitoring, you have constituents who are far, far away from their ability to get to a clinic. They have these, so much of what we see in the maternal and infant mortality space is preventable. And that's both heartbreaking and it's also good news because there's something we can do about it. And this grant, I think, really is trying to do something, press into that. Also, I've got 2 young kids and just with this whole process, my wife and me, I care a lot about it. It's kind of personal, right? So I would love to see a lot more done here to where we can get in front of these preventable issues. This is a funny acronym that I always love saying, make rural Tennessee healthy again, Martha. This gets into our chronic disease or addressing kind of those social determinants of health. So whether that's activity or having food as prescription or getting into access to better produce in an area, this kind of gets to that piece. And then using technology to improve care delivery or coordination. CMS has been very clear that they really want this to be an innovation-focused grant. So what their biggest hope for this is, and I'll say ours, the Department of Health as well, is that this isn't just there's money here for 5 years and then it's gone and things go back exactly the way they were before, but a way to really get our infrastructure to meet the needs ongoing once this money is gone and this grant is finished. So we see a lot of things where people are bringing tech into their clinics to lower overhead costs, where they go from not being profitable to be able to sustain themselves in a profitable manner. We see a lot of things where there's just no services at all. And they're able to get some services there, whether it's a telehealth or a teledoc. We've seen really, really creative ideas like putting satellite-enabled internet into ambulances so that when the ambulance goes out 2 hours into that holler, they're able to provide the service on the spot, get the teledoc, get the telehealth on the spot to help them, rather than let's make a taxi service out of our EMS that's traveling so far out and so far in just to deliver patients to basic care. And then finally is the reducing transportation barriers to care. So kind of a non-emergency medical transportation. There are some areas, I spoke with some county mayors who are out near Del Hollow Lake, and they are small population counties, but they have hundreds of thousands of visitors to their lake every year. And when someone rolls their ankle someone gets bit by something or whatever, their EMS is just a serious courier service of individuals. And now their primary way of healthcare in their county, EMS, is occupied delivering people. So those are some of the big buckets. So example one, maybe the primary goal of your project is to add behavioral health capacity to a primary care clinic in a rural setting. The project supports staff that's eligible, equipment is eligible, and minor modifications to the existing facilities are eligible. I get a lot of questions around what do you mean by minor modifications? If you are showing us a picture of a pole barn that you want to turn to a clinic, that's not minor. If you have a storage facility with all the running water and the gases and everything's there, and you're changing that room, putting a bed there, that's minor. So yes, I've had someone ask about a pole barn. If the primary goal of your project is to make minor modifications to existing facility to provide a new specialty clinical service to rural population, that counts. That is the service expansion and co-location grant that you would be interested in. I believe this one is already open. So I know a lot of folks, especially the county mayors I've spoken with, they look at this and they say, this might be a big one for us because we have a spot or we have a space. There is something that's already there. Or we have a facility that serves as that catchment area for rural counties and for those rural residents. Jump on it now. Go, go, go. I'm going to say that a few more times. Don't get mad at me. Example two, maybe the primary goal of a project is to purchase and staff a mobile unit that provides prenatal and postnatal screening and services for women and infants, or the goal of the project is to support school-based clinical health programs such as school nursing. That will fall under the maternal and child health. So this is made for the 89, as identified by HRSA, the 89 rural counties in the state. However, any of those 6 metro counties that are here in the state of Tennessee, if you are serving rural residents in that rural area, which we see a lot of folks who are based in the metro area serving outside of it, this is a great way that we see the co-location or the mobile units where they kind of go out and get in front of the catchment area that they serve. We see a lot of this happening as well. Maybe the primary goal of your project is to reduce substance use disorder and address adult mental health utilizing an evidence-based peer network model, or your primary goal of your project is to address housing for health as a non-clinical social driver of health, identified as a priority need of your county health council. That would be the Make Rural Tennessee Healthy Again grant, that Martha portion of this grant. And we're actually seeing a lot of this. If the primary goal is to reduce documentation burden by deploying AI systems in rural clinics that automatically capture and summarize patient-provider conversations in real time, or to improve billing accuracy and accelerate reimbursement by implementing AI-powered involvement. I have been blown away at how much this how much this will help. The hours that I've heard from the doctors and the staff saying, I could see more patients if I wasn't, my whole family is medical, and they talk about, well, yeah, I finish seeing patients and then I sit there and I do my paperwork for the rest of the day. This really is a great way to lower that administrative burden and lower, as well as get more things are filed correctly. Maybe one of the funniest things I have read in this so far is there was a article that came out recently that said the AI that was doing the billing for the healthcare services was more empathetic than the doctors, because it works to get it filed until it's filed correctly. It doesn't give up because it's got other patients to go see. It continues and it works that until it gets it filed properly. And so it's more accurate. And I thought it was hilarious that it said it was empathetic. Do with that what you will. But this is actually a great way to kind of equip our smaller areas or your larger areas to reduce some of that administrative burden. That's a good one. No, okay. So where will these opportunities be posted? If you go to tn.gov/health/rural, again, tn.gov/health/rural, we have webinars you can go see. We have all of these dates posted where you can see what's available and when. Send it to people. people who are interested or work in this area in your districts, please send it to them to say, hey, get on top of it. This is not just for elected officials and their bodies to be applying for. This is for 501c3s. We wrote this so that the doors could be as open wide as possible. We believe this is an all hands on deck problem, and it will require an all hands on deck solution to get help to make progress here. So that website will have, you can sign up for an email alert system that will say, hey, this grant is open. This one's closing. Hey, here is the presentation coming up where you can learn more now that you've signed up for this application. And then I don't know if it's on here. There's the notifications. This is the partner portal. This is if you say, yes, I'm going to go put in and make a grant application. This is the portal that it's going through. So before I touch on this, I'll say competitive.health@tn.gov. That is the email. If you have any questions of, hey, can I apply for this? Can I use money for these things? Can we have a consultant come to whatever your questions are? Can we partner with the group to write an application? Can we get letters of support from our mayor? Whatever the case may be. Competitive.health@tn.gov is who you will email. We have a team of 4 real live human beings who will email you back. And if they don't, you've got my email and I'll email you back. This is how we set up the scoring for this grant. And this is something that we really try to be intentional about because we do want our big healthcare is huge in Nashville. We do want those folks involved. They have to be. And we do want the small local areas that those large entities are not going to go there. But they're the folks who are in those communities that do care, they have an opportunity to score here as well. And so we wrote this where out of 100 points, the first 35 points goes to community need. So if you select your county and you're a rural, stressed, workforce disadvantaged type county, it will automatically, when you select your county, when you select your area, it's going to automatically pop in those things for you. We're doing that to on our end to do the best we can to lower the burden of applying for this grant. There is always a burden, as many of you know, to applying for grant. We're trying to do that by kind of stitching things in here as best we can. 35 points was the project quality. So if this is the community need, how are you meeting that? Sustainability, that is after this money is gone, will this keep going or will this go away? The evaluation plan, so how are you going to measure success of this? And then the budget, how are you piecing the dollars and cents together to make this all work? So that is kind of the rough mix that we've made for this particular grant. Here are some application required items. I'm not going to walk through this. I believe you all have access to this PowerPoint presentation. Michael's nodding, so that means it's completely for sure. They did I will note this because it is fairly significant that they cap the administrative costs here at 10% for this grant. That is lower than I've seen or that I know of. So that is a lower administrative cost that you may need to be aware of going into it. Here's a few things that you can see when you get these. Okay, steps to take. That's what I want to get to. If you go to any these links here, this is the tn.gov/help/rural. It gives you all the information you need. The link above, the Tennessee Department of Health.CASBO app, that's the actual application portal. I'm very proud that this state wrote its application. We did not outsource that. We went and talked to county health councils, folks around the state, to say what is the need. We're not going to hire someone who's just not from here to tell us what the needs of our state are, as well as we built our own grant application. So we did not put our money towards some great big software. We have had people in-house who made this, and it has checked off every single box that we looked for and more. So I'm very grateful for both of those things that I think will serve you well in applying for this. Finally, we know that this is a tight timeline, and we would push you to say, be working with your commissions, with your boards, with your Greater Nashville Regional Council, with your districts, with your legal groups to say, hey, we have to roll this out quickly. What can we do on some pre-approval process so that if we are granted this, we have to start spending pretty quickly. We have to get these contracts signed pretty quickly and get it all obligated, every dollar obligated by October 30th. I think I may sleep for 2 weeks when I pass that deadline. If you can get ahead of some of that, it will help you as well as us push through that to get these funds obligated and rolling out to you. This is what I've pointed to already, competitive.health.gov. If you have any questions, there we go. That's it. Does anyone have any particular questions? I'd be happy to give you my card. I have a couple cards here and
Thank you, Austin. I guess my biggest question is, how is there a formal definition of rural?
how is there a formal definition of rural?
Like, how would I know if any part, for instance, like, while we're a consolidated city county, an area like Bell's Bend, would that be considered rural under these definitions?
So we went with the, or we primarily working with CMS, went with the HRSA definitions, and it's basically there's 6 counties that are considered metropolitan in this grant, Davidson being one of them. Won't be shocked to know. However, any service provision occurring in the rural areas. So there's a lot of things that go on in Nashville just across the line. Any of those service provisions occurring there or primarily occurring there or primarily serving there do count. There's also a lot of, I think I mentioned, a lot of co-location going on where they're saying, hey, Nashville is a huge co-location, huge catchment area for surrounding rural counties. And we've already pressed clinics out into these other areas. What if we pressed school nurses, behavioral health, et cetera, whatever example you'd like to use, into those schools around us where we are kind of catching those before they come into our system and maybe is already overburdened or otherwise. I hope that answers your question.
I think so. I mean, what I'm hearing is it'd be tough for us in Nashville to be a direct applicant, but possibly a co-applicant.
I think that's right. Yeah. And I think there are ways to be a to be a direct applicant. And we are seeing a lot of things that say, hey, we are based here, but our mobile clinic goes out there so much, or things like that. But yes, it is, there is a line was drawn somewhere, and those 6 metropolitan counties are.
Other questions for Austin?
Yes, sir.
Yeah. Okay, Chris, after you. You're a member of the council. Go for it.
Real quick, is this applying just directly as a county or municipalities allowed to apply? Because I'll give the example, Sumner County, we've got 2 communities that are clearly rural under the 5,000 population mark, but for our county, that wouldn't be. So is that a differentiation, or do we need to do it differently for that?
Yeah, I'll just read off the 6 counties that are considered metropolitan, and as well as I'll say this about who can and can't apply. We have made it very, very a wide gate. We want cities, we want counties, we want private providers, we want tech companies, really anyone and everyone who is saying, I want to serve rural residents of Tennessee, because we need all hands on deck. Now, our application is meant, and the scoring of it is meant to say, are you meeting the community need? That's our biggest chunk, and you've got to jump. If you don't jump that hurdle, you're going to fail in our application. But the 6 counties are Shelby, Madison, Knox, Davidson, Hamilton, and Sullivan.
Thank you.
I have 2 questions. One is kind of along the lines of Mayor O'Connell's, which is that some of these definitions for rural or maybe underserved are just county-based definitions based on metrics that are sort of relative values across the state.
Yes. So these particular 6 were worked out with CMS and based on HRSA. So
on the community need 35 points there, is there an opportunity if you don't happen to be in a county that is determined to be sort of underserved to be able to demonstrate that you have needs within the county? I mean, that's a common approach, but it often it's a disadvantage to many of our communities who have, relatively speaking, at the county level, pretty good metrics, but significant need in rural or underserved populations within the counties. Is there a way to demonstrate that community beyond those?
Thank you for asking that. I'll give a quick example. There is a community that has a large service for behavioral health needs for children. And so while the county itself is doing quite well, the specific need that they're serving actually kind of serves as statewide. And they're able to say, hey, if this problem is like this in the worst hit areas, we've got a concentration of it like you've never seen, and they're able to kind of demonstrate that in there through either research or basic demographic. Like you can't just say we have a need and I promise we do. Right, there has to come with some citing sources. Yes, that is taken into consideration by
So
evaluators.
there's an art to the writing to demonstrate need beyond metrics. That's awesome to hear. And our staff can help with that, by the way, if you need any assistance. And then question about joint applications, consortium-based applications. Sounds like that's eligible. So if a couple of communities want to band together, or GNRC on behalf of communities wants to apply that.
Absolutely. So you're able to go in and select multiple counties that you're serving, or always in terms of putting one big application, I'll say we've had folks come in and say, we're going to bring in, we're going to fix this problem, this problem, this problem. And can we just dump in one big application? And we go, well, you have to do a line item for your grant anyways. Push these lines into this piece, this lines items into this piece, if that makes sense.
Okay. And then along those lines, a potential application from us may be to support our senior digital literacy program, which helps older adults get connected to online resources, help them be effective and safe in doing so. If we had a proposal that was aimed at access or training for telehealth services, would that be an eligible activity?
Yeah, lots of telehealth and teledoc things are in this. So yeah, I would think so without knowing the details. Yeah.
Even if it's not direct telehealth service delivery, if it's just helping them get engaged or trained to be able to engage those services.
To be certain, I'd email competitive.health@tn.gov, but I would, generally speaking, telehealth, teledoc is, yeah.
Well, I teed you up for that. So those are all the questions I have, Mr. Chair. Appreciate that, Austin.
Go ahead.
Mr. Chair, on the minor modifications, would engineering or architectural design services be required as part of the application? Or could that come at a later date?
I think I can come at a later date. So this is you obligate the funds by October 30th. Spending typically is a 2-year period from the feds. This is done in 1-year blocks. So you could write out a 5-year proposal, and it could include that engineering and architecture and scoping and building and finishing and opening services within that 5-year.
Okay, thank you.
Yes, sir. And then I saw someone back here.
Yeah, so most of these grants aren't intended for capital improvements, but you mentioned the legislature came and augmented 100 million. Can you talk a little bit about that, like the details of that?
Yes, so we will be releasing hopefully in the next, I'll say 2 to 4 weeks, the RAMP program, RAMP. You'll be able to see it on tn.gov/health/rural. And it was exactly because this federal grant came out and said, here's what it does and what it doesn't do. And some people said, well, we need that doesn't do piece. And it's
So is it gonna be like kind of distributed among different grant sources, like a standalone?
separate standalone, because we're getting a lot of things that are, you can apply to both, right? One does not preclude you from the other, if that's what you mean.
Yes, okay, awesome, thank you.
Thank you.
Other questions? Thank you, Austin. Very good. Excellent, excellent information. Thank you for that.
And if I may, my last name is spelled funny. It's austin.waters@tn.gov is my email. So if you just funky last name, that's me.
It's WOUTERS.
And I'll respond to however you pronounce it.
All right, thank you. Just call me. I don't care what you call me.
That's right. That's right.
All right, thank you. All right, we're ready for the chair's report. I want to say, Jerry, you're retiring as the White House Administrator, Jerry Herman.
Appreciate that.
Would
My last meeting.
you like to make a speech or something?
No, it's been 14 years on these meetings. I've seen a lot of faces change over the years. So is Michael, he's been at it a lot longer than I have. And a couple others have been here a long time, but I appreciate it. It's been great to be part of this program and being able to interact with all of you and network with you and make decisions that affect the whole region. Thank you.
Thank you for your service. Mayor McCall, while you were out. Yes. While you were out, we elected you chairman of the Committee on Redundancy Committee. So you'll take office immediately. I figured that.
Did you, orchestrate that call to get me out of the room?
Yes. Absolutely. I want to say thank you again for the opportunity and the honor of being the chairman of this group for the last 2 years. It's been a great honor to do that. We've got great momentum, speaking of that, because we have a dedicated staff. They make the buses run on time and keep them running with a very lean budget, as you saw, and the support of members of this group. So I want to say thank you for your commitment, and we look forward to you continuing to work in concert with the staff in the coming years. I think that's all I've got. Michael, I'll turn it over to you for your report.
Well, thank you, Mr. Chair. And if the buses are slow in your community, it's actually Steve Bland. Okay. To call. I got a few things, but I want to start also by just acknowledging how awesome it's been to work with Jerry over the last 14 years. I came back in 2007, and I think the next year you were hired as police chief for White House. And after Angie left to go home in East Tennessee, stepped into the role of city manager and just have been one of the best. We got several really good city managers around the region, and you were at the top of that list. And I think what I appreciate the most about you is just you always show up and participate. And that is like job one of all of us, is to be present, ask good questions. You ask good questions all the time. Tough questions, some of the tough questions don't always get asked out loud. You ask us directly as staff, members of staff, and it makes us better. And we will be sad to see you go, but happy for your retirement. And a really impressive day yesterday. White House had an opportunity to join Jerry and a few mayors. Mayor Isbell was there, Mayor Vogel was there, to see resolutions honoring you presented to you. Just really good turnout at a building that you had a lot to do with getting it on the ground. So just really proud of our partnership over the last 14 years, and want to do another round of applause. Thank you. So, thank you. I do have a couple of things to share from on behalf of my team. One is just make you aware of some grant opportunities. I'll highlight a few here, but just as an ongoing reminder, gnrc.org/grants. We put a lot of effort to make sure we're curating a list of grants that we think are going to be relevant for you on that page, as well as giving you direct access to grant listings with state agencies and the federal government. So it's a really great clearinghouse for you to, if you got one page to go to on the internet to know where there are grant funds, that's the one to go to. You also have contact information to our staff who can help with grant writing and grant administration if you are awarded a project. But the few that I wanted to call out today, one is this grant being made available through FEMA. It's the Building Resilient Infrastructure and Communities Grant, or we call it BRIC for short. It's something that that is being headed up at least at the state level by TEMA. So if you have any project ideas, we'll want to reach out to TEMA and let them know that you have an interest. Ultimately, we need to be coordinated with TEMA, but this is a really good opportunity for you to invest in projects that make your community more resilient to disaster. So it could be construction projects to improve or harden infrastructure, but also just grant funds to help you make sure you have really good building codes and local regulations that influence the way your community is designed and constructed at large to make it resilient to disaster. So if you're interested in this grant, this sounds like it's your cup of tea. Please be aware of the July 23rd deadline. There's about $1 billion nationally. Most of that is directed at the national competition. We've got some really good candidate projects across the region. So if you are ready to go with a grant application, I think you can come up with a 25% match. Even if you don't know if you can come up with that match, reach out to us and see if it's a good fit for you. The next three I wanted to highlight for you are through the U.S. Department of Justice, is Community-Oriented Policing Services Program, or COPS. There are 3 grant opportunities. One is going to help you up to $125,000 to help you staff your policing program. So this is the hire or rehire full-time sworn officers and deputies. The grant will cover up to 75% of entry-level salaries and benefits for 3 years. The next grant opportunity is up to $250,000 for launching or expanding officer wellness programs like peer support, training, suicide prevention, stress reduction, family services. As you think about the programming for your local law enforcement programs. And then the third opportunity is up to $500,000 for hardening school buildings and grounds. against threats. So training, deterrent measures, emergency notification, technology, and coordination with local law enforcement. I said a lot, the deadlines, those amounts, those eligibilities are all available to you at gnrc.org/grants. And then I'll just end at the Transportation Policy Board. We talked a little bit about this Federal Highway Bridge Investment Program. That's also posted online with a lot of other grant opportunities. So please check that out. Again, a big plug to Amy Napoli and her team in our ECD department who can help you write competitive grant applications. And then if you get the money and need help administering that project, we're happy to step in and do that for you as well. Lastly, I will conclude with just a look at upcoming meetings. I've highlighted here with the asterisk the meetings that involve elected officials. So the Transportation Policy Board will convene in this room on July 15th. On August 11th, we'll have our board of directors. That's 13 of you, including the officers that help execute the work program that was adopted. And then this body will meet again on August 19th. And what I assume will be a fantastic use of your time. So, Mr. Chair, that is the staff report on this June 17th.
Okay, any questions for Michael? All right, I want to thank Mayor Ryle for letting me ride second chair next to you during your 2 years of as chairman. So thank you for that. And you've seen the light come over to the municipal side of things. Finally. All right. Thank you for that.
Well, I appreciate you saying that. And we do need to sit down where I can go over the critical skill set it requires to be the immediate past president.
Okay. All right. Okay. All right. I'll be on a PIP, I'm sure. All right. Well, any other business to come before the body today? I'm going to come to the Oracle of Robertson County, Mayor Vogel, for final remarks for this meeting.
Well, I thought that in July we called meetings off. They don't work around here.
We've got Federal Highway coming to visit with you all.
Anyway, you worked around Jerry. I've watched him. His name's Herman. Y'all didn't know it. I've never seen anybody that's more dedicated to be this quiet. And when he does say something, people listen. It means a lot to me. Enjoyed being around this group. Yeah. I hate to see Bob go. Rogers, we're all about done, ain't we? What are they gonna do without us?
Better.
That's all I got.
Okay, that's enough. All right. Anything else? All right. We are adjourned. Thank you for being here today and for your participation.